in pediatrics, we sort of like regionalize neonatal care. We have different levels of neonatal care. Many hospitals can handle a well baby very easily, but there are hospitals like the one you're at, Maimonides, takes care of patients from various sources because they have different types of nurseries specialized in this care. Is that true?
That is correct.
Yeah.
Obviously, the more complicated, the more premature the baby is, and the more organ systems are involved, you need a host of specialists that can handle these type of issues. You need cardiologists to be able to handle the cardiac issues that may arise in the care of these babies. You need neonatologists that can handle the complication of the ventilation of these infants and the respiratory care of these babies, the various electrolyte issues and imbalances that these babies are facing. These babies have major issue of fluid balance and require very fine tailoring of fluids, nutrition via the veins, etc. So you do need a host of specialists that are capable of handling these type of issues that may arise, and most community hospitals may not be able to either afford or offer the services of such specialists, so that you need a center of a higher level to be able to have all these various specialists present under the same roof. And these usually are called tertiary centers, or centers that have a level 3 neonatal intensive care unit, where you do have the neonatologist who control and run the units. You have the cardiologist, the gastroenterologist, the pulmonologist, the surgeons, all the various pediatric subspecialists that are needed in the caring of these type of small babies.
And the way regional healthcare, which we're talking about in this particular specialty, actually saves money because you get it all centralized, you have better people, and takes the burden of some hospital couldn't handle a kid 24 hours a day, like it's done at Maimonides and many other places like that.
Well, it's more than just saving money. It's mostly
that
about.
We understand.
It's mostly about the saving the lives of the babies and getting the best outcomes, because these are very complicated sick patients that require the best of care, and they need the highly specialized trained nurses and physicians that are trained to take care of these type of babies in order to get the best outcomes. And these small outlying hospitals or community hospitals in most instances cannot offer that care to these patients. So they have to be transferred to the higher level centers that have the expertise and the personnel and the facilities and the equipment. Technology is extremely important in taking care of these babies. You need the proper ventilatory support with proper ventilators. You need the proper IV pumps that can infuse minute quantities of fluids to these babies without overhydrating them or underhydrating them. You need pharmacies that can custom tailor the IV solutions to these tiny infants. So it's extremely complicated.